Hi guys, my name is Neil. I'm an electronics engineer in New Zealand and it's May 2018. 2 weeks ago I had robotic prostate surgery, and in this next series of 4 or 5 videos I show the day within a few hours of the surgery, and then a short video each day for the next week or so. So if you're about to face the surgery like I was, and you're worried about it like I was, then please watch these videos, and I hope they provide you with some reassurance.
I'm recording.
After we get down there.
Okay.
Friday the 11th of May, and the surgery was 3 days ago on Wednesday morning. I'm out and about. We are staying in a motel here in Auckland, New Zealand, and just heading out to find some lunch. No real pain, just a little bit of stiffness in the abdomen. I've got 6 holes in the abdomen. The good news is that the bowels are working, the bladder's working, and everything is on schedule.
And wife working.
And the wife is working.
As caregiver.
So she's the caregiver. So we're just heading away to find something for lunch. I've been drinking lots and lots, and that's the key, according to the surgeon and the anaesthetist, to keep those fluids up. So I'm drinking about 2 or 3 glasses of cranberry juice and water mixed, about a 60-40 mix, which is easy to drink, and I'm drinking 3 or 4 of those every 2 or 3 hours. Alright, we'll report back tomorrow. It's the sequel to my robotic prostate surgery, which was 5 days ago, so this is day 5. I have done a video on day 0, day 1 and day 2 from memory, and I thought it's about time that we did a catch up. So today is the 13th of May 2018, and the surgery was on the 9th, so last Wednesday. Today is Sunday, and I have to say that all in all it has not been an unpleasant experience. I talked about the effects after the surgery, within a few hours of the surgery, and I won't repeat that. So we'll just take the shirt off and we'll show you the holes, because all of the other videos I've seen where people have talked about their surgery, they've actually avoided the nitty-gritty. So I apologise for this, but we have 6 holes in the belly, and I have to say that they're painful, but I can touch them. They're just tender. They haven't actually given me any grief. I would say that today has probably been a down day compared with the previous 2 or 3, primarily because my stomach is not normally as bloated as this, and so there is some bloating there, and so I can't eat or drink as much as I'm used to, and so if I have my normal breakfast, then I end up with shoulder pain not long afterwards, and that I understand is due to inflammation in the belly and irritation of the peritoneum, and apparently it's quite normal. But it's uncomfortable. It doesn't stop you from doing things, but it is uncomfortable. Let me tell you about this catheter. That's another thing that people avoid talking about. There is a tube, not that diameter, but that diameter there, in the old boy, and up and into the bladder. The part that's inside is about 300 mils long. There is a little balloon on the inside which can be inflated, and that's to stop it coming out. Heaven forbid you stand on it, and I've managed to avoid that. The catheter is no big deal. There are times when I forget that I'm actually wearing a catheter. This is what they call a day bag, which is strapped to your leg with a couple of elastic bands, and to empty it, you stick your foot over the toilet and open the tap and drain it 2 or 3 times a day. and then at night you unplug this end just here and plug in a bag which is bigger, and it's got a longer hose on it, and that larger bag lies on the floor next to the bed. So it's certainly not uncomfortable, and it's certainly during the day it's not a hindrance. I mean, I can walk around, get in and out of the car, and I don't know that it's there. This is the second time I've had a catheter. I had a catheter when I had a biopsy 2 or 3 months ago, and there is a video on that. I did get some irritation on the end of the tube where it goes into the old boy. I probably did a lot more walking then than I did now. That has not been an issue this time. The cure for chafing at the entry end of the catheter is this gel, which is called catheter gel, and basically it's KY gel with an anaesthetic mixed with it. And if you end up with chafing on the entry site of the catheter, a few drops of that gel solves the problem. I haven't had to use it this time, and I've had the catheter now for 4.5 days, but I did need to use it last time 3 or 4 months ago. So the catheter is no big deal. I wouldn't worry about it all. On a scale of 1 to 10 or 0 to 10 of the whole procedure, the catheter features about 1 in terms of discomfort and annoyance, and probably a 2 or 3 in terms of just being a nuisance. The big deal with me at the moment is the bloating of the stomach and the fact that I can't eat the normal amount that I'm used to, and I'm sick of drinking. Now I'll tell you what, the easiest way to drink the large volumes that you need to, and the reason you need to drink a lot is because one of the things you don't want is a bladder infection, and by continually drinking and having a reasonably high flow of urine into the bag, you're stopping bacteria from getting back up the tube and into the bladder. So what I'm drinking is about 30 or 40% cranberry juice and water. It's easy to drink, and I'm drinking about 4 or 5 of these full glasses per day. And of course you don't have to worry about getting up in the middle of the night, because it just simply doesn't happen. So I normally drink a full one of those before I go to bed, and I can sleep in the morning and look over the side of the bed. The night bag is full, and when you feel like it, you can get up and empty it. That's important to keep those fluids going. So today is day 5, tomorrow will be day 6, and sometime during next week I will visit the urologist and have an x-ray of the bladder to make sure that there is no leakage where they join the urethra. I'll just talk about that. If you don't already know, when they take the prostate out, they sever the urethra above the prostate and below the prostate, which is about that size normally, and then they join those two severed ends together, and they stitch them up. So one of the things they're a little bit concerned about is that there is leakage around that join. So a week after the operation, they will introduce into the bladder an X-ray opaque dye up through this tube, and then they'll take an X-ray and called a cystogram, and that will check whether there is any leakage from that join. If there is no leakage, then they'll take the catheter out, take some antibiotics, and go home. All right, thanks for watching, and we'll talk in another couple of days.